So one of the things I get asked all the time is about the role of AI in healthcare and where it's all going and how we're currently using it. This is a software program by a company called Panacea AI that we're currently beta testing, which is a triage tool. So when a surgeon gets a referral for a patient, typically that comes in the form of a letter. And this is a mock-up letter that we've created that I've downloaded from my imaginary patient management system. And the first step in the process is for the surgeon and the staff to read the referral, work out when they need to be seen, if they need any additional investigations. What this software does, it's an AI algorithm and trained to essentially triage the referral much the way I would. And so once the file's uploaded, we can then view what the AI algorithm thinks. And so this is a fictitious patient, as I said, but Sarah's been referred to us with a full thickness rotator cuff tear. The algorithm has a 98% confidence in its recommendations and the diagnosis. When we go in and look at how the AI has made those decisions, it's recognized that the patient has a rotator cuff tear, that it's full thickness, and that my preference is to see these patients within 2 weeks. The MRI shoulder has already been completed with the date and then what the findings of that are. The software has also seen that the patient has some shoulder arthritis, particularly of the AC joint. So let's go ahead and look at what recommendations have been made. Now, as the surgeon, I can go in and say that we think this triage result was correct and any additional things that I might like to say. So in this case, there's nothing that I'd like to give feedback on, so we can proceed as the patient's already had all the relevant imaging. And then we go over to the admin view. So now one of the administrative staff can say, oh, okay, Dr. Curry's seen that Sarah's been referred, and the recommendation or booking instruction here is to book the patient within 2 weeks. And then once that's done, they can go ahead and action that. This kind of software is going to streamline the way we get patients into the clinic, allow them to be triaged, hopefully in a more timely fashion, and ultimately reduce the administrative burden.